Hi, everybody. Good afternoon. Happy Thursday to everybody. We'll give it just a few minutes here while everybody gets logged in, and then we'll get started. Thanks for joining us today. Get started here in just a minute. Going to take just a couple more minutes here. As is always the case, we're going to probably have some folks rolling in a little bit late, which is certainly fine. I want to welcome all of you to the 2023 Virtual Spring Payer Forum. Today is day 4 of our event, and today we're hosting Anthem Blue Cross, now known as Elevance Health. And we have the pleasure of Miss Avis Boswell joining us. Avis is a provider relationship account manager for the state of Georgia. And she has been kind enough to put a presentation together that she'll share with you today. And hopefully you all have some questions. You'll see my instructions that I just put in the chat. Any questions that you have for her, either as she goes along or at the end of her presentation, feel free to share that information, or share your questions, and I'll make sure that they're directed to her, and we'll certainly try to get you an answer. If for some reason we can't, we'll certainly Avis will get that information to us, and we'll push it out to y'all. So without any further ado, Avis, if it's all right, go ahead and take yourself off of mute, and I will let you get started. Let's go ahead and make sure you can share your screen. Okay.
Okay. Let's see.
Yep. Just need presentation mode, I guess, and you're good to go.
Okay, presentation mode.
Right there down at the bottom. Either way, down at the bottom, that little looks like a pull down screen. Next one over, keep going over that one right there.
This one.
Yep, and then just hit enter too. Okay.
Got it. Thank you, Bill.
Thanks so much. And I'll let you know if there are any questions that come through about what you're talking about. And let's see, I'm looking at your next slide as well as your note screen as well. If there's a way for you to just do the one screen. I think you have to go down along the bottom there, maybe in one, the third or fourth icon over, I think might do that. I apologize that I'm not certain, but yeah, let's see.
Let's see. I should have done this before.
Hide presenter view, I think. Try that, see if that does that. No.
No, I don't see anything. So.
Okay.
Oh, goodness.
That's all right. No worries. We'll get it fixed.
Let's do this. Let me try to figure this out.
Go ahead and stop share and restart share if you prefer. It's all good. No worries. We'll get it fixed. Just yeah, stop share and then maybe restart the sharing your screen.
Yeah, let's work on this again. Share screen. on the presentation. I apologize for the
No worries.
difficulties.
No worries. It's technology is a crazy thing. There we go. And then
Okay, so back
whatever.
at square one.
Yeah, back at square one, and I'll let you figure out there.
Yeah, let's see. I only want to show one screen, so I think this Zoom is in the way. Not now. Okay, I think it should be showing from the beginning. I think I'm gonna figure it out.
It's okay. We've still got some people joining. There we go.
Okay.
Good deal.
Perfect.
Ladies and gentlemen, I present to you Miss Avis Boswell. Here we go.
Right. We got it together, Bill. Thank you so much for your patience. So like Bill said, my name is Avis Boswell, and I am currently a provider relationship account manager for Anthem Blue Cross Blue Shield of Georgia, which is now known as Elevance Health. And I'm so excited to be presenting to you today. Thank you for those who joined, and thank you for those who are watching the presentation. Like Bill said, we will hold any Q&A at the end of the presentation. So let's get started. Let's see. For today's agenda, we will focus on the following items: provider focus and resources, provider relationship account managers, update demographic information, Availity essentials, Availity technical support, policies, guidelines, and manuals, AIM, which is now Carillon, Provider Learning Hub, and the Georgia Provider News. The Georgia Provider Relationship Team, which I am a part of, is where we can assist you with the following educational opportunities for our providers. Provider relationship account managers. To meet the service needs of our providers and facilities, we've assembled an experienced staff of provider relationship account managers who can help with the following items: questions related to your provider contract, training and education on Anthem products, programs, and self-service tools, provider orientation, and fee schedule request. You can contact your provider relationship account manager by going to anthem.com/provider/contact us. If you need to update your practice or provider information, these are some of the tools that are available at the Anthem Provider Maintenance Form Provider Portal. Providers can change their demographic information. This includes practice mailing addresses, contact information, hours, or other information which can be performed by visiting anthem.com/provider/provider maintenance form. Anthem requires at least 30 days advance notice of these changes. You can also add a provider. If you are an existing contracted group and wish to add a provider, you may visit anthem.com/provider/enrollment. If you wish to remove a provider from your panel for practitioner departures or removing a provider, you may go to the provider maintenance form that I mentioned earlier to give us notice of that change. We require 90 days advance notice to allow us time to transition members to a participating member so that there is no provider or member abrasion. Also, refer to the termination clause in your provider agreement for additional requirements. You can also add a new location if you are an existing contracted group and wish to add a new location. Again, you may go to the provider maintenance form portal to notify us. And again, this notice must be given to us 30 days in advance. For additional guidance, providers may review the tips for individuals and organizations and provider maintenance form instructions. If you need to access prior authorization, benefits, information on disputing a claim, submit a dispute electronically, or send additional information requested by Anthem, you may utilize number 1, Availity Essentials. This is available 24 hours a day, 7 days a week for participating and non-participating providers. Providers can submit prior authorization request, get current patient insurance coverage information, submit and monitor the status of claim submissions, view remittance advice, inquire about previously submitted authorization request, dispute a claim payment or denial, and send us medical records, invoices, itemized bills, or other requested information. Or you may simply contact provider services by calling the number on the back of the member's ID card, or call 1-800-676-BLUE, which is 2583, to speak to a provider service representative. If providers need Availity technical support, providers can contact Availity Client Services at 1-800-282-4548 or visit the Availity support community. Providers can also log into Availity, select Help and Training, choose Availity Support, and select your organization. If you don't have an Availity account, you can register for access and view the on-demand and/or instructor-led trainings to become familiar with Availity's robust features. Availity is the preferred method for contacting Anthem. Again, Availity is the preferred method for contacting Anthem. Availity Chat with Payer is also available during normal business hours. Get answers to your questions about eligibility, benefits, authorizations, claim status, and more. Log into the Availity Essentials and select Anthem from the Payer Spaces drop-down menu. Then you may select Chat with Payer and complete the pre-chat form to start your chat. There are several resources available in the Availity portal. If providers are looking for policy, guidelines, or manuals, at Anthem, we're committed to supporting you in providing quality care and services to the members in our network. On the anthem.com/provider/policies page, you will find the following information. Information for assessing coverage options, guidelines for clinical utilization management, practice policies, reimbursement policies, the provider manual, and support for delivering benefits to our members. AIM Specialty Health is now known as Carillon Medical Benefits Management. Carillon is a specialty benefits company that supports Anthem in managing non-emergent, outpatient, and facility and non-facility based services such as radiology, cardiology, sleep, radiation oncology, musculoskeletal, genetic testing, and cancer treatment pathways. Do you need Carillon Medical Benefits Management, which is formerly known as AIM Specialty Health, technical support? You can get convenient online services through providerportal.com, or you can call Carillon for support directly at 1-800-554-0580. As a reminder, ordering and servicing providers may submit prior authorization requests to Carolyn directly at providerportal.com. Online access is available 24/7 to process orders in real time and is the fastest and most convenient way to request authorization. We also offer the Provider Learning Hub. Use our library of self-paced courses and instructor-led training sessions, which is available 24/7 at no cost. These learning opportunities will assist you in administering your patient's health plan and provide you with the knowledge to best assist our members. You may navigate to www.anthem.com/provider to start training. Some things to keep in mind. The first time a provider selects a course in the Provider Learning Hub, they will need to complete the registration form. No further registration with a username and password is required. Course follow-up and reminder emails will come directly from On24. Georgia Provider News. Our provider news publications offer quick reference sections on topics you care about most. A few of these topics includes policies and programs, filing claims, products, administrative updates, new or revised procedures and guidelines, pharmacy information, plus more. Be sure to visit providernews.anthem.com/Georgia. Register for Provider News and start receiving all provider news via email. Please be sure to register today at messageinsight.com/network update. We finished the presentation quite early, so we do have room and time for questions. At this time, if you have any questions, please feel free to ask questions. And if we have an answer, we will provide an answer. And if we need to follow up, we will provide provider follow-up. Back to you, Bill.
Thanks, Avis. I might need some clarification on this, but someone's asking, is that the link login or begin, let's see, or begin the application on the provider screen? Is that the link to log in or begin the application process on the provider screen?
Which screen are we talking about, Bill?
Let me see if, Wendy, if you can give me some more info on your question.
What is the provider trying to do? If I have that, then I can better understand what the question is.
Yeah, I just asked her for some additional detail. Wendy, just trying to clarify your question. If you can resubmit or clarify your question, Avis can better answer that. And I think she threw it out there when you were on a particular screen. So let's see if she pops up. In the meantime, someone says, can you please go back to the slides with the phone number for Anthem and Carolyn?
Okay, let's see. That was this is the AIM Specialty Health, which is now Carolyn Medical Benefits Management. You can reach out to Carolyn for support at 1-800-554-0580, or you can go via online at providerportal.com.
Wendy says on the anthem.com/provider screen, is that the link to log in or to begin the application on the provider screen? So let's see. To navigate to start training. So can you clarify that?
Okay, so I'm assuming this is about the Provider Learning Hub information. So the provider,
she said there's two links. So maybe let's see what the next slide says. Does that have something on it too? No. Back up one more. Let's see. Yeah, go, let's see, forward, go forward. I think it said provider portal. So maybe the difference between, there are two links for login and start application, she said.
Okay, let's see.
Back, hang on, slow down just a little bit. Back up 2 slides, I think. One more. See how down at the bottom, register for access, and then further down it says log in to Availity Essentials. Maybe that's, let's see, and maybe go back even one more. I thought I saw something else on there.
Okay, so is the provider attempting to contact Availity?
I'd have to, let's see. Let me see if I can allow her to talk, if that's okay.
Okay.
And we can
Sure.
do it that way. Wendy, you're on mute right now, but go ahead. You're off mute if you want to clarify your question. I apologize for the confusion.
Okay, can you hear me now?
Yes. Hello, Wendy.
I'm on that screen, anthem.com.provider. And when I get there, there's several links there. I just want more information about how to use this particular website. So when I do that, there is hold on, I'm trying to, there's a link that's, when you look at it, there's a login. And then when you go down a little bit, it says, join us, interested in joining our provider network. And there, begin application. So I didn't know which one we needed to do. Login, which I've never actually logged into Anthem with a login.
Okay, so I'm assuming that you're talking about the Provider Learning Hub.
Yeah, yes, of course.
Okay, because it says navigate to anthem.com/provider to start training. So right. The first time a provider selects a course in the Provider Learning Hub, they will need to complete the registration form. So you will.
Okay, so does that mean begin application?
There's a screen on there, Avis, that says begin application. It says, interested in joining our provider network. We look forward to working with you to provide quality services to our members. Begin application. I suspect that that's where she has to basically sign up or enroll.
Right. So I'm not sure. I'm not sure that's what you're trying to do, Wendy. It sounds like you want to register for the Provider Learning Hub. You don't necessarily, you're not trying to start an application because you're already an in-network provider. Is that correct?
Yes.
Okay, so no, you would not submit an application to become an in-network provider. What I can do is I can take your information and I can follow up with you, because to my understanding, once you navigate to anthem.com/provider, you would be required to register, but not submit an application. So okay. There's something there that I would need to follow up with you about that.
There is another link that says log in. So maybe that's where I need to hit log in, and then it's asking me
to register.
Well, it's saying, please select your account type, Medicare, family, Medicaid, but I'm more of the information for the provider.
Mm-hmm.
Well, and you know what it's doing me? It's bringing me back to Ability. It brings you back to Ability login.
Okay, so this is what we can do, Wendy. We can take this offline and we can work with you to make sure that you get in the right place, because we don't need you to fill out an application to become an in-network provider. You're already in network. So we want to make sure that you select the right option. So I have no problem with following up with you after this phone call, after this presentation.
Or Wendy, if you want to put your email, if you don't mind putting your email in the chat, I'd be glad to pass that along to Avis and have her reach out to you directly.
Yes, that would be great. Thank you, Bill.
Thank you.
Sure.
Thank you.
All right. And we had another question come through. Could you go into more detail on the timeline it takes Availity to communicate with Anthem? We've submitted multiple medical records and itemized bills directly to the claims and availability, only to be told 2 to 3 weeks later, the payer never received the documents.
Okay, that is a great question. So what we can do is we can take that and we can follow up with Availity, because again, Availity is one of our vendors. So we would have to speak with the leadership with Availity to get more information on the timeline when it comes to documents and receiving information.
Avis, have you heard that issue before, though? Have you heard that come up before? Because I know that's not an issue that's necessarily new. I think that's something that's been an ongoing challenge.
Yeah, I think when it comes to Availity, we're working with this vendor to kind of get in sync with their schedule and the timeline. So it is a known issue, and it's something that we are addressing, and it's something that we are working on. So again, I'll take this back to the Availity leadership, and I'll be able to follow up with the individual who posed that question. So I have no issue with doing that.
All right, let me make sure I've got it documented, okay? Hold on for me. Just a
Absolutely.
second.
I think these are all great questions. So definitely we'll follow up with the providers to make sure we get some answers.
And then I'll push it out. I'll push it out to the people that attended. I'm sure they'll want to know that. Let's see.
Absolutely.
Okay. All right, I'm just getting some information here and adding that to. Okay, and let's see, I think I had another question come in on the chat.
Okay.
Oh, I just got Wendy's contact information, so let me just mark that down real quick.
Okay, perfect.
And I will send that to you after the presentation, Avis, and you can communicate directly with her on that issue about the login and everything.
Okay, sounds good, Bill. Thank you.
Let's see. Let's see what else we got here. Yep, and someone asked if the presentation will be available, and it is my intention to share that with the attendees as soon as I get that final presentation from you.
Yeah, Bill, we're still working on that because right now it's an internal document. So we have to get it approved before we share it externally. So once we get that, I'll make sure you get a copy of it for distribution.
Yep, please do. That'd be great.
Okay.
Okay, I would ask the group if you have any more questions. Some great questions so far, but as it relates to submitting claims, following up on claims, I know when you bring in availability into the equation and everything, just syncing everything up, sometimes the information isn't consistent. So I know that's been an ongoing frustration. So we'll look forward to getting a response back from Avis on that. Any other questions as it relates to the communication? Avis, what is your, I'm sort of putting you on the spot here, but what's your schedule for communicating with providers throughout the state? Do you have sort of a regular schedule of checking in with them, or do you pretty much wait for them to reach out to you?
Well, Bill, one of the good things that we've created internally is a web portal, or an online portal, should I say, for all of our providers so that they can submit their inquiries through the email repository, and it will go directly to their designated or assigned provider relationship account manager. So we created that. And typically when we receive emails in that inbox, we have about a 48-hour turnaround time to respond to those inquiries. So I will get that out to providers. I did not see that email. I did not see that information in the presentation. I'm so glad you brought that up. I'll make sure I get that out to the providers and to you as well. Because again, once that email hits that inbox, we have about 48 hours to turn that email around. So providers are very satisfied with that inbox because there's a quicker response time, and we're just getting some great reviews and some positive feedback from our providers when it comes to that email box.
Does it assign them a case number or something perhaps
It
when
does.
you do that?
It does. Once that email hits the inbox, the provider will receive like a tracking number or a case number. So that way they can follow through with the inquiry that they submitted. So it's just created such a better process for us to be able to keep track of our provider inquiries and to just make sure that we're tracking and following up with our providers.
Great.
Mhm.
Okay. Let me make sure I didn't miss anything on the Q&A. I think we're good. Let me just take one last note here.
Mhm.
Okay. All right. I think that is all the questions that came in for right now. So we should be in good shape. I just want to thank everybody for their participation today. It's been a good week so far. I want to thank Avis for her time and attention today. You guys, this is an ongoing dialogue with these payers, and I know it's very important to have your information handy. We talked yesterday in our session about the importance if you have multiple claims that you're experiencing the same issue with, and you're inquiring about the status of those. It certainly can be helpful. This is kind of a no-brainer, but it can be helpful to be researching those collectively as opposed to on an account by account basis. If you have several accounts with the same issue, then certainly make them aware that you have a number of accounts and significant number of dollars that are pending that need attention, and maybe you'll get a more satisfactory result if you do that. But there are a lot of resources available online through the portals and everything. Georgia HFMA wants to be a supporter and a resource for you to help you get the information that you need. If you have any questions, don't hesitate to reach out to me. Don't hesitate to reach out to any of the leadership at Georgia HFMA, and we'll do our best to get you an answer, or at least get you directed to the right person. But everybody that I've talked with in preparation for this payer forum this week, without exception, has been very supportive and very cooperative, and more than willing to help with any provider issues that might come up. So I would encourage you to do that. It's a tough job y'all have out there, and I know your organizations appreciate it, and we certainly appreciate y'all participating today. Georgia HFMA has a Spring Institute coming up in early May, May 3rd through the 5th. We're hosting that up at the Hotel Avalon up in Alpharetta. So I hope that you'll look at maybe attending that. You can go online at hfma.org. Under the Discover tab, there's a Find My Chapter, plug in Georgia, and it'll give you all the information you need about different events, as well as our leadership as a chapter. And HFMA wants to be your partner out there with all things related to finance, healthcare finance, and revenue cycles. So with that being said, it doesn't look like we have any more questions at this time.
Actually, Bill, I'm sorry, I forgot something. That email, it's in the presentation. I forgot that I went over that. If you look at the slide that I'm sharing, it says at the bottom right corner, contact your provider relationship account manager. So that email is on there. So it's www.anthem.com/provider/contact us. And once providers go to that link, they will be able to submit their inquiry, and it will be routed to the appropriate provider relationship account manager for that provider. So my apologies, it was in the presentation.
Yeah. No worries. Just curious, are you anticipating as part of the rebranding any change to that, or has that not been discussed? Everything's going to stay Anthem for now, not Elevance?
Yeah, that hasn't been discussed. Right now, it's business as usual. So I'm sure you know all about that.
Yep. Yep, absolutely.
Yeah. Yeah.
All right, we appreciate everybody. If nobody else has any other questions, we'll go ahead and conclude our session for today.
Sounds
Okay.
great. Thank you, Bill. Thank you,
Hey.
everyone.
Appreciate it so much. Thanks.
Thank you.